Hi, I'm Dr. Dudson. I'm sure most of us are aware or have heard the saying that you can't find what you're not looking for. And I think that's especially important when it comes to ordering and knowing what blood labs to order for evaluating to see how your blood sugar is doing, whether you're pre-diabetic, also known as insulin resistance, or whether you are in a diabetic state. And it's very important that the appropriate labs be ordered. Now, I'd like to talk a little bit about those today. The first lab that is very, very important that would be included on the blood test is your fasting glucose. Now, your fasting glucose tells us, it literally is just, if you will, a snapshot in time. It's just a picture of what your blood sugar was at the moment they stuck the needle in you to take the blood sample. And that's an important number to know. And that number, again, abnormal starts becoming considered abnormal if it's above 99 to 100 on up from there. What is considered a really good blood sugar range would be something in those low to mid 80s up to about low 90s. Somewhere in that range would be considered a really good optimal fasting glucose. The next test that I frequently find is not included on people's blood labs is called the hemoglobin A1C, or known as the A1C test for short. That is a test that, at least after today, I would like you to be aware of it and insist that it be included on your blood test. What that one does is that test allows us to see what the average of your blood sugar has been over the last roughly 90 days, 3 months. And that's really essential. That gives us much more of the big picture of what's going on. And what is considered a normal range on that one is anything below 5.7 is considered a good number, down to about 4.8. And 5.7 up to 6.4 is considered puts you into the pre-diabetic, also known as insulin resistant stage. And when your A1C hits 6.5 or above, then you are officially diagnosed as a diabetic. So obviously, we want it down below 5.7 consistently. So that's very, very important. The last test that I think you need to be aware of, that a lot of people don't make the connection, they've heard of it, but you haven't made the connection to the blood sugar issues, and that is your triglyceride blood test. Your triglycerides are directly connected and influenced by how well you're managing your blood sugar, and so it absolutely must be looked at and correlated with the A1C test and the fasting glucose test. So you want to make sure all three of those are included. You want to make sure that you fast 8 to 12 hours before you go in and do your blood test. Otherwise, it'll artificially throw these numbers off. You want to also make sure before you go in, make sure you ask the doctor. I think you'll always find that they will include the fasting glucose and the triglycerides, but frequently I see that they do not include the A1C. And that A1C, you can have a normal fasting glucose and an abnormal A1C. You could have a normal glucose at the moment that you go in for the blood test, but really over the last 3 months, the majority of the time it is abnormal. And that's how we can pick these up. And for a lot of people, they only get their blood test done once a year with their annual physical. And so it may not be done again for another year. And you could be deep, deep, deep into things like insulin resistance or diabetes before you get another blood test. So insist that the A1C is included. If for any reason your doctor will not include that, maybe it's time to consider switching doctors, because that literally is the gold standard for looking at how you're evaluating your blood sugar. So make sure these are included. Make sure you fast before you go in. Make sure you know your numbers. Do not accept your doctor to tell you that, oh, it was all normal. You want to specifically know what your fasting glucose was, what your A1C was, and what your triglyceride numbers are. I trust this gave you some helpful tips to better understand your own blood labs.